Good evening. I'm Pittsburgh City Councilman Daniel Lavelle,
And I'm Councilman Reverend Ricky Burgess.
and we welcome you to another episode, I guess, of Black Pittsburgh Matters. Black Pittsburgh Matters is a series of virtual town hall meetings affirming a citywide agenda that Black Pittsburgh does indeed matter. Black Pittsburgh Matters mean that Black lives matter. We must protect the health and safety of Black people. It means that Black communities matter. We must focus on rebuilding Black communities. And it means that Black wealth matters. We must increase Black employment and entrepreneurship.
The Black community has been disproportionately affected by concurrent crises. First, the COVID-19 pandemic and the resulting economic crisis, and secondly, race relations, which is a public health crisis. Normally, in times of crisis and great change, we would be coming to you as the Black elected officials of Pittsburgh and having meetings across the city with our constituents, partners, and allies. Since we cannot do so safely in the current pandemic, we are now using this media and platform to come to you in the ways in which we can to talk about what we're doing and discuss policy and legislation concerning Black Pittsburgh. These meetings are available via Facebook, YouTube, and the city's cable channel. You can contact or ask questions via the Black Pittsburgh Matters Facebook page, or you can email us at blackpghmatters, that's blackpghmatters@gmail.com. And you can comment through our live feed right now. Today's town hall meeting topic is Pittsburgh Community Police Reform Task Force Report.
Working together, Reverend Burgess and I have sponsored a package of police reform bills that passed City Council and was signed into law by the mayor this past summer. Those 6 pieces of legislation include: 1, establishing a hiring freeze in the Bureau of Police. This legislation defunds the police recruit and first-year police officer line items in the Bureau's 2020 budget. 2, the demilitarization of the police. This legislation bans the purchase of surplus U.S. military equipment and weapons by the Pittsburgh Bureau of Police. 3, banning chokeholds, forbidding the Pittsburgh Police from using chokeholds when subduing citizens. 4, establishing a duty to intervene. This legislation requires all police officers to step in and stop other police officers from using illegal or unnecessary force or any other violation of a person's constitutional right. 5, establishing the Stop the Violence Fund. This legislation requires the city to dedicate dollars equal to 10% of the police budget annually for funding evidence-based violence prevention and social service programs. And then lastly, number 6, there's a question on this fall's ballot. The legislation will amend the Home Rule Charter, strengthening the Citizen Police Review Board. But what I need to also acknowledge is that while these bills came on the heels of social unrest that began with the murder of George Floyd, this is not our first time in implementing police reform legislation.
Yes, we have over the years passed a variety of police reform initiatives, including PERC, which is now called the Group Violence Initiative, which is bringing former gang members, former people who've been reformed onto the street to dissuade young people from committing crimes. Increased use of cameras. We have cameras now installed in various places in our communities. ShotSpotter, gunshot detection system, that's now in probably most Black communities. If you shoot a firearm, they will be able to detect within 45 seconds the exact location and caliber of the shot. The Maryland Lethality Assessment Model, which prevents homicide, domestic related homicide, that Judge Spurgeon, who used to be over that division for Stephen Zappala, the DA, said was the single most important tool in reducing domestic related homicide. The national initiative to build community trust that David Kennedy, who also designed PERC, brought that to Pittsburgh. We were one of the first cities to receive that training in implicit bias and racial reconciliation and procedural justice. And most recently, the Stop the Violence Initiative, which is a coordination program to look at a variety of social service programming and connect them with the police in order to make our communities safer. Together, we have led this process of combining effective social services with smart community-based policing.
It's also worth noting, Rev, that since passing our police reform legislation, we have also read the 12 demands of the collective, which were delivered to the mayor and the county executive regarding their concerns around police reform and recommendations that they have. And we've also read the recommendations of the newly released Police Reform Task Force. And we've been working on comprehensively responding to all those demands from a city government programmatic level. And I'm pretty excited because we hope in the very near future to be able to introduce a new initiative that will address both the social programming that is identified in these reports, as well as the violence prevention methods. And we hope to be able to announce the funding that will take this program citywide.
Yeah, a lot of times what people don't understand is that it's not easy. We can't just snap our fingers and make change. Unfortunately, government change takes thoughtfulness and deliberation because we are constrained by the state in many ways. But we have been listening to the protests and to all interested parties, protesters and all interesting parties, and we've done what we could to reform our city. And the idea is to, I think, to move further. That's why tonight, to speak about the task force research process and the report that they've authored, we're honored to welcome task force co-chairs, Dr. Quentin Bullock, president of CCAC, affectionately, I call him my president, and Ms. McDonald Roberts, the chair of the Housing Authority, and task force members, Professor David Kennedy, who is David Harris, rather. David Harris, a national expert on racial profiling, and Miss Amanda Green Hawkins, Assistant General Counsel for the United States Steelworkers. Good evening, all, and welcome to tonight's town hall meeting.
Good evening.
Good evening.
Hello.
Good evening, all. Thank you, first and foremost, for joining us. What I would like to do, just from an educational perspective, if we could start with our co-chairs, if you could please give our guests an overview of what the Pittsburgh Community Police Reform Task Force is, maybe provide a brief overview of the task force's report for viewers who may be unaware of it, and just give us a little bit of background.
Dr. Bullock, you want to start?
I'll start, and you can pick up all these details. First, thank you for the opportunity to join my colleagues and to talk to the community about the important work that the City of Pittsburgh Police Reform Task Force worked on over a period of 3.5 months. We started in June with a charge from Mayor Peduto that provided a charge to the committee asking us to come from a community perspective made up of very diverse stakeholders, 15 members that would work collaboratively to lay out a blueprint that would be authentic, that would be thoughtful, and would set a list of recommendations that we feel would be able to provide some recommendations and guidance for police reform. I had the pleasure of serving in this capacity with Valerie McDonald Roberts, and along with 13 other distinguished members that were represented from higher education, law, community-based organizations, activists, and philanthropists. By having such a diverse group, it also allowed us to really dive into the discussion and to really debate, discuss, research, and to invite a variety of members in who are experts in their field to talk to the group and for us to ask questions and to better understand specific areas. As a beginning component, as you can imagine, getting 15 diverse individuals together, this was not an easy task. We had to first discuss what are we going to focus on, because this is such a broad and important topic. And I believe we came up with about a list of about 30. And through a couple meetings and discussions, we were able to get the areas of focus down to 8 key areas. And those areas by title, the cluster, are the following: eliminating racial disparities, officer wellness, reimagining policing, recruitment, training, education and hiring, relations with Pittsburgh's Fraternal Order of Police, transparency and accountability, use of force changes needed in Pittsburgh's Bureau of Police policy, and use of tear gas, rubber bullets, flashbang, devices, and other less lethal methods of crowd control. So those were our 8 key areas of focus. We assigned a chair to lead each one of those areas, and members of the task force worked with the chairs to begin the work by gathering the literature, scheduling speakers, and presenting and discussing with the entire task force in the following meetings. I'll defer to my co-chair to add to the preliminary introduction that I provided.
Thank you, Dr. Bullock. Yes, we did have a variety of people as far as their experiences, as far as their knowledge of government, policing, etc. We went from the gamut of people who knew a lot, like a Tim Stevens, who has been on the forefront for many, many years as far as police reform, through people who it is their first time dealing with government and policing. So Mayor Peduto has provided a broad spectrum, and in terms of experiences, in terms of the specialties that the task force members came from or had, and as far as gender, age, you name it. We had all the demographics, and he was very intentional in making sure all the demographics were there. We had young people who were involved in the protests and the demonstrations, who were our youth voices, because as has been said, it has been the youth, it has been young people who have been the fodder, who have been the fire under our feet. This would not have happened had we not been pushed nationally by our youth. So when Mayor Peduto called upon us, we were very excited and very pleased to be able to serve in this needed capacity. I do want to say that also and somebody said, reporter says, I thought you were going to be people oriented. This was the maximum of people orientation because it wasn't the usual suspects. We had ranged from the gamut of experiences, from social service agencies to somebody like me, a former government official, advocates, etc. As far as some of the topics that were very important, and then I'll defer to you, Councilman, as well as to Dr. Harris and Amanda Green Hawkins. Some of the major topics were de-escalation, which is critical. De-escalation of what happens on the street, transparency, needing more data, needing the public to understand what is going on, accountability, big subject, it's been a subject forever, and training. We talked about recruitment. What type of people are you recruiting? Are you going back to retrain in implicit bias? Are you holding police officers accountable? So without saying much more, I don't want to take away the thunder of the impending discussion. But the task force also wants to thank you, Councilman, for your legislation. Believe me, we talked about chokeholds and intervention. So we were very pleased that you all made this legislation that is implementable as far as policy. So that basically talks about where we were at. And one last thing, as far as people oriented, we reached out, the task force chairs, as well as the members, wanted to reach out to a number of organizations and people, such as the LGBTQIA community, the Gender Equity Commission, youth advocates, former police officers, the CPRB, the Citizens Police Review Board, OMI, Office of Municipal Investigations. We wanted to have a very comprehensive understanding so that we could have a very valid and very pertinent report to submit to the city. Thank you.
I think that the report is very comprehensive and obviously has the mark of scholarship in it. I want to ask a real basic question, both to, I want to start with Professor Harris and then to Amanda. But in plain talk, is there something wrong with our police? Is there, you know, we've had both nationally and locally, is there something wrong with our police? Is there something inherently wrong with our police process? Professor Harris.
Well, I want to thank everybody for inviting me to this discussion. And is there something wrong with our police? I say we're all aware, including members of the police department, including the command staff, that we can do better than we are doing now. We found a number of areas in which police services and the routine activities of police really attracted our attention as far as some of these problems. For instance, just the evidence in the police department's own data of racial disparities across a number of routine kinds of activities. Even as the police have ramped down arrests and ramped down frisks in our city, the disparities have gone up. And that's something we should be paying attention to. We knew about the various incidents over the years, the names of which I'm sure would come back to you here in Pittsburgh, of a use of violence or force in ways that seem to upset many members of our community, and there was not sufficient accountability for them. That, I think, is something that needs to be addressed. And the whole accountability mechanism seemed very opaque to a number of our members, and they want better data on all these things. They want the police department to be much more transparent and to come to the most basic place. They want to know that when there is misconduct, there are consequences. And if there aren't, they want to know why. And I think we heard those voices. Many of us had the same frustrations, the way I heard my fellow members of the task force. And many of the aspects of our report that you've mentioned and that our co-chairs have mentioned go to address those very issues.
Well, good evening, and thank you, Councilman Burgess and Councilman Lavelle, for allowing me to be here. I would say, as far as the Pittsburgh Bureau of Police, if they're doing anything wrong, I think was the question. But I think first I want to mention something that I learned about our police in the course of our meetings. And that is that our police department is, by many measures, and those can be debated, by many measures doing well when it comes to policies and practices, and that they tend to be ahead of other police departments around the country because of things that have been done in the past. So I do want to mention that. As far as things that could be done better, of course, there are always things that could be done better. And these are some of the things that we flushed out during the course of our meetings, during committee meetings and things. And one of the things that I would mention that I think could be done better, and this was brought up by the city solicitor's office, and that is that the police bureau can do a better job when it comes to consistency in disciplining police officers, so that Officer A, who does the same thing as Officer B, gets disciplined in the same way. Not that Officer A gets written up and Officer B gets nothing. That is going to be very important in the schedule of discipline is going to be very important in determining what should actually be disciplined. Because when you see discrepancies and disparities in the issuance of discipline, it leads to questions as to whether or not something is permitted or condoned, or if people should be disciplined at all. So that's something that I think we could certainly do better.
So you both mentioned a number of things I actually want to talk about. So I'm going to start with data. Mr. Harris, you spoke a lot about data. The report speaks a lot about data. how can we go about one collecting the data better, but also then making it transparent? Because the report talks about making the data as transparent as possible. What does that actually look like, and how can we do that?
Well, it's a great question, Councilman Lavelle. We are not, as a city and a police bureau, collecting nearly enough data on routine police activity. If you go from city to city, and we talk to experts from outside Pittsburgh, you will see a much richer collection of data elsewhere. Um, and how do you collect it? There are a whole variety of ways. Sometimes it is the officers themselves that are the source, but it can also be done through technological solutions of various kinds. And then as far as making it transparent, this is key. We heard from some people who have built transparent data systems for other cities, such as the New Orleans Police Department. If there was ever a troubled police department in this country, deeply troubled, it would be that one. And it's much better now for a variety of reasons. But the thing that was very striking about what they told us was they're now looked at as the most transparent police department because you build a dashboard essentially that gives almost real-time access, nearly real-time access to the data on all kinds of routine activities by the police department. Numbers of arrests, numbers of traffic stops, stops and frisks, all these things. It's easy to, I'm overdoing it when I say easy. Nothing is easy. We know that. But it can be done in ways that are easy to systematize, to put into a system, and then you share it with the public. For too long, the city itself, and the police bureau is just part of it, has had more of a culture of what do you need to know that for? And we just need to turn that completely around with the technical expertise of the types that we saw. And we did not have to reach far to find this. It should be in real time and broad and deep. Right now, the citizens of Pittsburgh get data on routine police activities once a year after the year is over through the annual report. And that's just not acceptable. I mean, we have to do better than that. We've got two great universities here who do all kinds of work like this. We can use the models from other cities. We don't have to invent the wheel on that.
One of the things that we collect more data, as Dr. Bullock, I think, began to talk about, and I'll come back to him to begin the conversation, is about racial disparity, right? That we know that there is, and this racial disparity in terms of arrest and stoppage has, I think, also an impact on how communities of color view the police, right? Their experience with police is a very different experience than communities of wealth and privilege. And so the report begins to talk about how to eliminate those racial disparities. And so, Dr. Bullock, I'm curious as to your thoughts on, the recommendations and your thoughts on racial disparity and the Pittsburgh Police.
As we all know, building on what Dr. Harris just referenced, transparency plays a key role in addressing those, helping persons to look at policing differently. It's also important in how police are trained and prepared to serve in that capacity, and that they are provided the necessary training from cultural sensitivity, language sensitivity, representation of the communities in which they serve, better understanding of the broad, diverse populations, and the commitment that they bring forth to really be ethical in their work and to always put community policing first and center in their views, to be very, very positive. It was also recognized that as relationships can be developed, and that's developed by getting to know the individuals within the community, those relationships begin to bring that level of trust. The availability of data also brings that level of trust. So combining that, being open and transparent with the community, begins to remove the racial disparities that perhaps have occurred over the years, and the police are more fair in their activities to really present a very positive service to the community in which they serve.
Others that want to weigh in on that topic? Racial disparities.
I'm sorry?
So,
Racial disparities, how we eliminate racial disparities. Anyone else want to weigh in on that topic?
Oh, well, the implicit bias. I mean, that's definitely one of the things in the training, recruitment part of the report is implicit bias is part of the training module. The task force looked at the what the training looks like for any cadet. And there are a number of different subjects within the whole training curriculum. And the implicit bias is just one, but it doesn't have as many hours or credits, so to speak, as you see other parts of the curriculum that are very strictly police oriented. In the report, in our task force report, it is highly recommended that implicit bias be prioritized, that it not be just the cadet level training, that it not be one time and you're done. It needs to be annual, it needs to be repeated for all of the police, as well as accountability to make sure that there is a review. When we talk about, when Dr. Harris talked about data and Dr. Bullitt talked about the data, that's one area of data is the racial breakdown. What's in data? It's black and white. If it says that, there is disparity, it's going to be quite evident from the numbers. So again, the implicit bias training is very, very, very important in and the data to make sure that it is reviewed, not just annually, like Dr. Harris said, but routinely to see where we're at in terms of racial disparities and to hold people accountable for that.
It's so true. And what you have to do is not just get the data, but follow through on it, follow up on it. You have to say, okay, we see a disparity here. And by the way, disparity is not the same thing as saying there is discrimination. It means there's a difference. And can you explain it? And you would ask this of any police officer, the sergeant or the lieutenant might do that. And then we ask the same kind of questions of the department itself at the department level. If there is no non-racial explanation, well, then we have to get rid of that disparity. Now we must ask, what's your plan for getting rid of that disparity? Why are there so many traffic stops in this area for these kinds of things when they're not happening over there in this other community? It really does get down to that kind of granular follow through. That's so important.
And when we're talking about data, I think it's also important to mention not only what the police officers are doing and getting data from that, but we also have to look at how our communities determined to be underserved or to be a place where we're going to have a greater police presence. And that's something that we were looking for data on as well. How is that determined? Is it because someone feels that way, or is it because of statistics showing instances of crime at certain periods of the day or times and things like that? That's what we're looking for. Other than that, it seems to be arbitrary as to how the community could be targeted for greater police presence. And when you have arbitrary decisions being made, that's where you run a greater risk of having a lot of problems.
So towards that end, then, Amanda, I'm curious where you or how you view predictive policing models. Recently, City Council, we received a lot of emails and a lot of calls from concerned citizens about predictive policing, where we essentially use data to be able to say, well, we suspect that more crime will occur there, and therefore we need to dispatch more police into that community. Did you all discuss that at all?
Well, I can only say from my time during the larger meetings, it's not anything that I recall being discussed in my particular committee, but during our larger meetings, we talked about, I remember asking a question specifically about how is it determined that a community is underserved? And it wasn't quite clear to me that there was data available at all, perhaps, or maybe at that time to explain to us how the community would be described as underserved. And I do understand predictive modeling, but we still also need to be careful that that stereotypes and bias aren't going into that data to then target certain communities again. Because we're hearing a lot about analysis of data and how when you have humans dealing with the data, the biases seem to come out, right? And so we have to be careful. I understand the need for it, but at the same time, we have to be responsible and attuned to what's happening with the communities.
That's so correct. With these predictive models, what happens is the biases from the past, from the data we use from the past, gets baked into the prediction. And then we're no better off than we are now, except now we got a sheen of numbers on it. So it looks very objective, and it's not. It's just the humans who've done things in the past. It's their biases coming up through the predictions.
And also with the predictions throughout the report, in terms of trying to put a hold on certain measures such as tear gas and rubber bullets and other dispersive means, and as far as traffic stops, et cetera, as we have recommended that there be experts, outside external partners that come in and review the city's data, that it's not just all internal, that there are other eyes on the city police, on our public safety, to see where we need to improve, what needs to be tweaked, to give us recommendations, so that we don't have a biased predictive type of model, that it truly is unbiased, as well as working with not just external partners, but community, is to make sure that the community comes in and is allowed to review. I guess what I'm going to say is we don't want it to be so insular. We want the city of Pittsburgh police to be a lot more open to outside ideas, to the community input. There's a lot of good ideas out there, and they do need to hear it. And you'll find that throughout the report.
One of the things that I commend, that I found was interesting, commend the authors of the report for, was this whole discussion of officer wellness, actually. You know, being a police officer is extraordinarily stressful, right? I have said publicly, it's not secret, that I've always been in favor of giving police raise because they're putting their life on the line, and you cannot overestimate the value of single life. So I'm curious to hear more about your thoughts about officer wellness, how important that is, and the things we can do to support the health and mental well-being of our officers who are doing this essential, but also very, very difficult job. I think, you know, in many ways, if you look at the outcomes of officers in terms of suicide, depression, alcoholism, you know, they'll rank high in those charts because their job is just so stressful. And I commend the authors of the report for making that a priority. So talk to us a little bit about your recommendations for officer wellness, and do you think that's as important as I think it is in the report?
I would say it's very important because we first acknowledge that officers are human beings. And in the line of work that they're doing, there are great possibilities that they will face physical and emotional challenges. When this occurs, how is it acknowledged, and how do we connect them to available services to assist them in addressing those two areas or even more, which could be substance abuse, alcoholism, marital challenges, drug addiction, and the list goes on. And if that should occur, do we have a service that is available for not only the officer, but also family members that could also participate to help them get the necessary resources and services to help them deal with those challenges? When you have a well-rounded officer, you have a well-rounded delivery of services, because the challenges are not impinging their thinking, their actions, their responses to any of the cases, because they are clear-minded, astute, and are physically capable of doing the very best job that they can.
Following up with Dr. Bullock, and you would like this, Rev, is that the Sharon Werner was the subcommittee chair for officer wellness, and she asked to involve Rabbi Ron Simon and Minister Darnell Drury. And through external communications, they also had Lydia Barlow, who is Christian Associates. So to get together to talk about the faith-based component to officer wellness. At the time that we met, there was really no definitive police chaplain, and it's kind of like standard a police chaplain, but it really didn't materialize. So through their efforts, they are hoping to be able to work with the City of Pittsburgh Police to establish a real collaboration with faith-based community to encourage officers to be able to talk to people. See, right now they go through, if they have problems, or they could be recommended to go to some type of counseling to work through problems that they may be having personally or on the job, whatever. But a lot of times they don't. Police officers are, I'm sorry, there's just a tough mentality there. And they don't want to show any pain and no weakness. That's the whole mantra of I'm a police officer. And it doesn't do them well, as you know, that they could have problems that impact them at home and on the job. But through a faith-based component, working with Chief Schubert, working with Public Safety Director Hisrich, there may be more of a proclivity to be able to bare your soul, so to speak, and to be able to work out some things. So again, that's just one a component of the report is, and it's pretty intense, it's the faith-based collaboration with the City of Pittsburgh Police. That's just one area of officer wellness.
I also think it's important to note something that I recall seeing about people in the healthcare profession, particularly those who work in emergency rooms, and how when they're under stress, they're more likely to revert to bias in responding to emergencies. It's what they know, it's what they're comfortable with. They need to make a split-second decision. What do we know about people who look like this or people who act like that? And when we're talking about officer wellness, I think the same thing can apply. If we're dealing with officers who are under a great deal of stress, then we need to look at helping them become well, alleviating some of that stress, dealing with some of that stress, so that perhaps they're not using bias to make those split-second decisions in those emergency situations. So it's very important.
So part of what the report talks about in terms of bringing on sort of a wholesome police officer is the actual hiring process, the qualifications, and the training needed to become sort of an effective police officer in the city. Now, I'm wondering if any of you can speak a bit about the guardian mindset. That wasn't something I was very familiar with until I read the report. But speak maybe about the guardian mindset, community policing, and some of the cultural changes that the task force suggested.
Yeah, I would be glad to talk about that. Too often in too many police departments, this is not just Pittsburgh, but too many officers think of themselves as warriors. It's a war on crime. It's a war on drugs. There's the bad guys out there are the enemies. And by the way, they're pretty hard to tell from the civilians who are not. And therefore, in a war, you have collateral damage, you have casualties. These things just happen. That's the wrong mindset. And American policing in general has been pervaded by that mindset through training, through police culture in lots and lots of ways for a couple of decades now. Where we need to move is exactly what you're talking about, toward a guardian mindset. And that simply means the idea of that you're there to take care of the community. You're there to protect the community. It's not a war. War is not a way to think about domestic policing. It's not a way to do domestic policing. This goes far beyond the use of military equipment. It's a mindset. And so the mindset of the guardian is quite different. And for those who are interested, I'd recommend looking at the 2015 Presidential Task Force report, the President's Task Force on 21st Century Policing. It's widely available on the internet from the Obama administration. It describes guardian-style policing, that caretaking function for the community. You know, just a few of the differences. A warrior mindset, you cluster around your own people and you protect your own people at all costs. The guardian looks to protect the law and the people that he or she is supposed to serve. The warrior reacts instantaneously and uses violence whenever necessary. The guardian stops, thinks, is careful, even doubts, asks questions. These are big, big differences in approach. And more, still small numbers, but more police departments are taking on this guardian approach. And I cannot stress how important that is to a cultural shift within the police department. It can't be a war, because any war out here becomes a war on the people of this city. And that's just not good. Never has been.
So I have a follow-up question then, if I could, Rev. Do you believe that the warrior mindset in any way affects how we go about crowd control, or how we choose to deploy crowd control measures, which we saw happening, or which are being contested of what happened in our city this summer? So I'm just curious, if do you believe there's any connection there? And if so, how do we move away from that? Or what do you believe appropriate crowd control measures should be?
I do believe there's a connection. I think there's a definite connection. I mean, I saw the film just as many of you have, of police officers in riot gear and so forth. This becomes a paramilitary force at that point. Anytime police have what are called less lethal munitions, things like tear gas, like pepper balls, like flashbangs, like rubber bullets, the temptation is there to use them, and without prejudging the legal actions, because I know nothing about the internal things that are going on there. It did seem like they were used inappropriately, just from what I could see. What the task force recommended and what I would stand behind is bringing in, as our co-chair McDonald Roberts said a few minutes ago, we need an outside evaluator to tell us not about those incidents, but whether Pittsburgh is properly trained, whether the policies are in place, and whether the officers know how to use those things with restraint and use them only when necessary. I think there's some evidence that indicates that that was not the case. It is that mentality. Well, I'm just going to use this because I'm going to use it. This is the weapon in my hand. And I know it can't kill because it's labeled less than lethal. These are mistakes, and I think we need to get away from that mentality.
I have to chime in also, follow up to Dr. Harris. Dave, you're right. And in participating in, as co-chairs, we did participate on subcommittee meetings, and in the recruitment, the education recruitment, and I don't know, Tim Stevens' title was like this long as far as the subcommittee. It is like everything in there. But the one thing that a senior police official administrator said this, it was said that they are trained to have guardian mentality, but that is the standard. But they also must be able to revert to a warrior mentality when the situation is called upon. What David's going towards is this: there needs to be proper training so that they know when the warrior mentality kicks in. There will be a time where warrior mentality kicks in to protect the public. We understand that. But for most of the time, overwhelming majority of the time, it needs to be guardian. But any police officer, if they're worth their grain of salt, has to be both. They have to be both. They will hurt themselves and hurt others if they're not able to revert to a warrior mentality. And at the same time, they will hurt the public if they only go in with warrior mentality, where it's too easy to slip into that. So again, they're trained to be, the baseline is the guardian mentality, and hopefully that'll be their whole day, is a guardian mentality. But we do need external trainers. We need people to come in and train properly how we should disperse crowds to make sure that we're doing it right. I'm not saying they did everything wrong. For the most part, things were peaceful, but there were incidents that they weren't peaceful and that they did use excessive force when they really didn't have to. So I think we need a second set of eyes to come in and say, well, what did we do right? What we do wrong? And more importantly, I believe the mayor said this. I'm not sure where I heard this. They are thinking about for crowd disbursement, for crowd is to have more supervision, trained supervisors to be there on the spot to make sure that that warrior mentality and basically unrelatable. It should not be there. So we need trained people in situations where I think they thought they were trained, but there needs to be more training.
So the area that I'm probably the most interested in, and I'll start with you, Amanda, and I'd like to actually hear all of your thoughts on this. But this whole idea of reimagining police, right? There's been this national cry to defund the police, and some cities have actually dismantled the police force. Your recommendations certainly don't say that, but they do talk about reimagining the police. And I have some ideas on what that means, but I'm curious, in your minds, what does it mean? What does reimagining the police look like? Amanda, what's that look like? What's reimagining the police look like?
I think one of the things that we have to think about is, what do we want police for? What do we want to have a line item in the budget to pay for police to do what? And do we want them responding to mental health crises? Do we want them responding to cats stuck in trees, right? All of these other ancillary things that they do, but don't necessarily come along with true law enforcement purposes. Now, I do understand that there are probably plenty of police officers who would welcome the opportunity to help someone deliver a baby, right? Those are some of the joys of the job, right? But when it comes to other things that take them away from more urgent needs in the community, I think we need to reevaluate how we can better respond to other needs in the community and have our police do the job of law enforcement. So I think reimagining policing really has to do a lot with what the community wants police to do, and then taking a step back and carving out all of this other ancillary stuff and making sure that we have the resources necessary to do the necessary for people with those issues, and let police do law enforcement.
I agree with that. I think that's right on target. When I hear the words reimagining policing, what I'm thinking about, what is the total group of services we're having police do now? And they, as Amanda said, we're responding to a whole bunch of things that are not about fighting crime. And they're also responding to calls that arise from homelessness and drug addiction and mental health crises and so forth. And those things can lead to very, very bad results, as we saw the other night in Philadelphia when the police there responded to a mental health crisis. A man ended up dead. We need to ask, when do we actually need the people with the badges and the handcuffs and the guns? That's what, and which of those do we want them to go to? And then if we don't need them for these other things, we actually have to create the other services, the communications that will get the other services there. We had a lot of discussion about 911 and things like that. We have to fund the other services and then transfer the responsibility for those other things to the other service providers. That's what reimagining policing means to me. I don't think we're yet at a point where we could do without, nor would we want to do without our law enforcement apparatus when it's truly needed. But we have to isolate what those situations actually are and move other things into other categories. We can also do that by decriminalizing a greater number of things. And I'm not just talking about decriminalizing cannabis, That's the one that bumps into everybody's head. But, you know, Eric Garner died because it was criminal to sell loose cigarettes.
Right.
I mean, what? We need police for that? That should be a crime? Traffic offenses, most moving offenses are criminal. I can see DWI, I could see reckless driving, but failing to use your signal, we need a police officer to actually do that, and then things go wrong. So I think there's a lot we can do to reimagine the ways and the situations that are right for police services and the ones where we want some other solution.
So some of what you just spoke about is policy, right? And at the sort of beginning of this, me and Reyes spoke about policies that we've worked on. I'm just curious from a local perspective in terms of what we can control, as we reimagine police and as we look to decriminalize. Are there other policy initiatives that you think that we should be adopting and or working on locally?
I can say that the mayor's office, I mean, we have GVI funded, which was that was excellent piece of legislation, as well as Stop the Violence funding. You need that. And the mayor's office is now trying to implement it, and I'll get it so wrong, but I'll just say Laura Dragowski. But the office of whatever, she was a critical communities manager to be able to bring in more of these external people to work with the police, social service workers, et cetera. And as David duly said, that Philadelphia incident speaks volumes of what the report that we submitted addresses. But with bringing in other external people there, we really do need to have different type of funding for these social workers. I'm going to give you an example. I participated in the U.S. Conference of Mayors forum facilitated by Mayor Lightfoot in Philadelphia, Chicago, excuse me. And I just have to say this, bear with me for about 2 minutes. An incident happened where one of the chief of police that participated on this webinar said this. There was a domestic violence issue. And that is a lot of the phone calls that police get. And that's where social workers and de-escalation venues, et cetera, need to come into play. They had both a social worker and a police officer. They got to the door. The man was obviously violent. The woman showed signs of that. They managed to de-escalate, they thought, the male, took the female out of the household to outside where it was safe. And she began to talk with the social worker, giving her resources that were absolutely needed, that the police should not have to do, but that social worker is more trained, is much more trained for that. While the two, the woman, the abused woman, and the social worker were talking, the male that was in the house went in and got a gun, and he proceeded to shoot. The police officer, because they had a bulletproof vest and he was armed, managed to defuse that situation with that old warrior mentality to make sure that no one was killed, no innocent person was killed. That is an incident where you cannot say just the police or just a social worker. If it was just a social worker, there'd have been dead bodies. If it was just the police, it probably would have been worse. But because they were both working together, they managed to be able to keep the peace, to make sure no one was killed. That's what we talk about, reimagining, and that's what we're talking about. Is, do you need one or the other? You need both. You do need both. So it's a spectrum. There's so what this task force realized. There's so many gray areas. It's rarely black and white. There are a lot of gray areas. But we had people that, like academians like Dr. Harris. We had Amanda who researched total accountability and Act 111 and all that good stuff to give the black and white. But there's a lot of gray, more gray than anything in between.
And there are some good benchmark programs out there that have examples of areas that could be realized in city of Pittsburgh with the Oregon model that speaks about the crisis assistance help where they utilize just what was just described, where persons are accountable for the mental health. So if it's a mental health, they go out and accompany the police in addressing it. They also have a model out of Denver for the support team assistance response, which is another partnering up on non-emergency requests that's specific for a 911 call, and they respond with the key persons with the police. And then there's also some work out there that talks about non-police contact interaction with the driver and the passenger, meaning an action is done, but there's no interaction. It's done through technology or some other electronic means to address that change. So are those components that can be embraced to help in areas of reimagining the work that we're doing in our local police force? If so, will that also bring in one way of increasing trust, presenting transparency, and strengthening the police force to be a greater service and a positive service to the community as a whole?
So if we could, I would like to bring in Micah. Micah is essentially the producer of the show, and she's been monitoring the live questions. And so I want to give her an opportunity to ask any live questions that are out there.
Yes, good evening. So our first question is from Gabriel, asking how the task force was chosen, how the members were chosen and how it was developed.
Okay. What happened is the mayor had put this together, and I can't speak for him as far as what his rationale for certain people, but he went the gamut from community advocates and activists, from young to not so young, because I'm not old, right? Quentin and Dave, we're not old. So from nonprofit, foundation community, corporate community, and Quentin, am I missing anybody?
Philanthropy, and the law.
And the law, yeah.
I would think that Mayor Peduto was probably looking to tap persons who would bring a different wealth of knowledge, skill sets, views, not necessarily opinionated, but open-minded, willing to embrace a new challenge, do the necessary research, question what's presented before us, and then be authentic in our response in developing a report that's clear and easy to follow and offer concrete recommendations.
And to Dr. Bullock, he facilitated the meetings to keep us on target, keep us on a timeline, make sure that we had, information, etc. It was a very good partnership. Thank you, Dr. Bullock. But one thing I have to be very honest, no, we were not on the same page at all. We came from different perspectives, and there were definitely disagreements. When people say, oh, is this a kumbaya type of task force? Heck no. We were disagreeing. We weren't arguing, were we? No, we weren't arguing, but we were disagreeing. Sometimes some of us moved a little bit and compromised. Sometimes we didn't budge. And sometimes we just had to come to a consensus. And this is what makes this an excellent report, is that what he did is got people together that he knew weren't going to be on the same page. And we had to sit at the table and talk to one another. That's what I would say for the Pittsburgh community absolutely needs to be done. We have to talk to one another. We have to listen. We have to talk. We have to try to get on the same page as best we could. That's what this task force was a model for.
Thank you. And so did you all find any specific problems between the LGBT community and the police when you were doing your research for the task force?
Who wants to speak? I talk too much. David or Amanda?
We did have a group come in to speak to us about that very thing, did we not?
Yes, we did.
Yeah, it was a very, very good session. I'm very happy that one of our task force members, I believe it was Nate, was it not?
Yeah.
Yes, yeah, Nate Yap. He suggested that we do this, and the people who came and spoke to us really gave us a lot of information, helped to enlighten our views about what their particular problems and issues with the police department were. I'm very grateful that they came.
It was Ciora Thomas, and very much so advocating for the transgender community to make sure that there was training to be able to have police react accordingly. Again, with the transgender community, to make sure they understand what transgender is, to refer to people. I'll tell you what she came up, what she told us is that unfortunately, in certain communities, there may be people who are working in career venues that may not necessarily be as tasteful as people want to accept, but it's making a living. And please treat all people with dignity and respect. That was, I think, more of what the community wanted. I mean, what she wanted to advocate for. Treat all people with dignity and respect for who they are. And we got that.
Thank you. And after developing the report and doing all of the research, in your opinions, what is the number one problem with police and policing, and what is the number one solution?
Wow. I'm going to exercise my right to dodge the question just a little bit and give you an answer to something else, because I think the number one issue now is implementation. I want to know who's going to implement it, and I am going to be among the people watching to see what happens to this report. Because I can tell you one thing we did agree on, up, down, and sideways, was that nobody had any interest in doing all this work to have a report sit on a shelf. We want to see these things get done. There are 8 core areas and over 100 recommendations, and they cover the waterfront as far as every area that we can do to improve police, to augment our own city, make it better, make it safe for everyone. And we want to see that these things get done. So for me, the biggest issue now is implementation. I hope you don't mind my dodging a little bit for that.
And I would approach it to say that they're all a priority, because each one will have an impact on the overall enhancement of the delivery of policing, community policing. So implementing elements in all of them will have a positive impact or a transforming impact on community policing as a whole.
I think it's important to mention something that has been coming from the community for a long time, and that is that there's a perception that there is a lot of racism in policing, and that perception brings with it a rift between the community that's to be served in the police department, and that divide needs to be bridged in some way. And I say perception because to know someone's a racist, you have to know their hearts and minds. And I do not know that for fact, but that perception is real. And because there's that perception, there is a problem between the police and the community. We got to fix it.
And also, one task force member repeatedly said that, a lot of people aren't going to, is this report going to be well received? And Dr. Bullock, if you can chime in as well, we met to generate a very thoughtful report that would be impactful, maximum impact. And therefore, that's why it took so long. It took over 3 months, hours and hours and hours of discussion, reaching out to other community organizations, external partners. We had to embrace the passion and the anger that was out there, and we had to temper that with the facts, with research, with data that we had, and focusing on Pittsburgh. We had to balance it all, and to come up with a thoughtful report, as Dr. Harris said, is that something that is not going to sit on a shelf. Therefore, there was a lot of thought put in there to make sure that some recommendations are maybe a little aspirational. Some of them are easily implementable. It runs the gamut. So again, I think it was a very comprehensive deliberation that the task force performed. And we're very proud of the report. And more than anything else, I was asked, will the young people be patient? I think young people and people that are out there scrutinizing, they, as Dr. Harris said, they want to see something done. They want to see incremental progressive change. That is it. That's what will keep people patient, is seeing actual accomplishment. It not reimagining everything all at one time, but incremental change. And I think that's what's going to happen with the mayor, who has committed to that.
Well, towards all of your points about this being a living document, I will tell you that both myself and Reverend Burgess, as soon as it was released, read it and really began thinking through, how do we ensure that this is a living, breathing document that is not simply sitting on a shelf, and how do we begin implementing the recommendations that are within our scope and within our realm to actually be able to implement. And then we had a conversation with the administration, who I also believe wants to ensure that we are actually able to move on this document. And hopefully in the very near future, we'll be able to announce how we're actually going to do that, because we are in active conversations about making this as real as possible. With that being said, we have come up on our hour of spending time together. And I want to thank you all for your time and helping educate us. One, I want to thank you first and foremost for the 3 months or 3 or so months you spent working on the document so that we could indeed reimagine policing within our city. More specifically, I want to thank our guests for this evening, Task Force co-chairs, Dr. Quentin Bullock, the president of CCAC, and Ms. McDonald Roberts, chair of the Housing Authority. I also want to thank Task Force members, Professor David Harris, who is a national expert on racial profiling, and Ms. Amanda Green Hawkins, Assistant General Counsel to the United Steelworkers. In order to really have a truly successful Black community, is imperative that we make ourselves safe and peaceful. I believe this report is going to help us do that. And you should also know that we're committed to implementing both this report, but also rebuilding Black communities in Pittsburgh for Black people, by Black people, with our partners and allies.
I want to echo, I sincerely thank you for your leadership, your willingness to serve, and Councilman Lavelle and I are committed to leading with the mayor the implementation of your recommendations. I also want to thank our viewing audience for watching and participating in this town hall meeting. Remember, you can watch this show on Facebook, the city's YouTube channel, or the city's cable channel. A new meeting occurs every Wednesday. By working together, united in purpose, we can transform our city, strengthen it for all of its residents. Pittsburgh can only be a city for all when it becomes a city where Black Pittsburgh matters. Good evening, stay safe, and be blessed.